Hi, my name is Monet, and this is a presentation regarding the legal risk and management within a physical therapy clinic. And this presentation is for Kinesiology 550. For this assignment, I chose a physical therapy clinic setting, particularly because these facilities focus on rehabilitation, injury recovery, and therapeutic exercise programs that are designed to improve mobility and overall function for its patients and clients. The target population typically includes injured individuals, so injured patients, post-surgical individuals, people who have recently had surgery, and those with mobility limitations. The environment is a clinical setting that includes therapy equipment, treatment tables, and supervised rehabilitation spaces, not limited to include aquatic therapy as well. And I chose this setting because of my background in kinesiology and my interest in pursuing a career in physical therapy. I also have experience working in a similar environment in an outpatient clinic, which allowed me to get an understanding of how legal concepts apply in real world clinical settings because while I was working at my clinic, we did have a few safety issues and legal scares, and as such, physical therapy clinics do involve a high level of responsibility due to patient care, rehabilitation protocols, and supervision. And all of these things make them a strong setting for analyzing legal research or analyzing legal issues such as liability, negligence, and professional standards. So, regarding our first example of risk management, negligence in the physical therapy setting, this case is regarding negligence in a physical therapy setting. So, Sensky versus Madison Avenue Physical Therapy. In this case, a patient was injured during a rehabilitation exercise and claimed that the therapist failed to properly supervise and progress their activity. Negligence involves four elements. One is a duty to the patient, a breach of that duty, causation, and resulting damages. In a physical therapy clinic, providers have a pretty clear duty to deliver care to the patient, and meet their needs, to uphold these standards in a professional manner as well, and to progress exercises safely based on each patient's needs and physical condition, which does have the ability to change. And in order to reduce risk, clinics should perform through thorough evaluations and maintain detailed documentation, design individualized programs in order to cater to the specific needs of the patient, and to closely supervise all exercises. It is important to make sure that staff are properly licensed and educated and trained to help make sure that all of the needs are being met, and that the standard of care is not being neglected, and in order to minimize liability overall. Our next example is a case that involves inadequate patient screening. So this case focuses on the importance of proper patient screening and evaluation. And in this case, Hansen versus Big Stone Therapies. The patient was injured during treatment, and it was alleged that the therapist did not properly assess the patient before initiating care. And in a physical therapy clinic, it is important that providers meet the standard of care by performing thorough evaluations and making sound clinical decisions. This includes identifying the risk factors that may exist. It's important to monitor patient responses and adjust treatment as needed. And in order to reduce this risk, clinics should conduct thorough initial assessments when the patient first walks in through the doors. And it's important to also document findings clearly to make sure that there's no confusion, and also to reassess patients regularly because needs do change throughout the course of treatment. And when necessary, it's important to obtain physician clearance um, before progressing exercises and protocols. It's important to also follow evidence-based guidelines because this can further ensure that patient safety is being upheld and in order to reduce liability also. Our third risk management example, this is regarding equipment and facility safety. So this case focuses on safety in general, regarding the equipment specifically, but in Edwards versus Campbell, the injury was linked to an unsafe mechanism regarding the machine. So it was a improperly maintained piece of equipment, and it raised concerns about the clinic's responsibility to provide a safe environment. This case falls under the premises of liability, which means that the facility had a duty to ensure that the environment and equipment were safe for patient use. And if this duty is breached and the patient gets injured, the clinic may be held liable. To reduce this risk, it is important that the physical therapy clinic regularly inspects and maintains all equipment. It's important to remove faulty or unsafe items immediately. And it's also important to ensure that the facility is clean, free of hazards, trip hazards. And staff should also be trained on proper safety procedures in order to prevent accidents and to protect patients. Moving on to employment laws. Our first example is age discrimination. So this case focuses on discrimination in the workplace, specifically regarding age. And in this case, Moore versus University of Notre Dame, an employee alleged that they were treated unfairly due to their age. The Age Discrimination Employment Act, ADEA, protects employees over the age of 40 from discrimination in the hiring, promotion, and termination realm. And in a physical therapy clinic, it's important because the employment decisions must be based on qualifications and performance rather than age. To prevent this issue, clinics should implement age-neutral hiring practices. It's important to also document employment decisions and ensure that staff are trained on discrimination laws. It's important that everyone is well educated, and in total, to accumulate all of these things together, these strategies promote fairness and also reduce legal risk. Our next example of employment laws is the Equal Pay Act. This case focuses on pay discrimination in the workplace, and specifically this case is Purdue versus the City University of New York. The plaintiff alleged that they were paid less than others for performing equal work. This raises concerns about gender-based pay differences, which is one of the most prevalent examples or complaints within the workplace regarding discrepancies in pay. This Equal Pay Act requires that employees perform pretty much similar workload or uphold similar workloads, perform similar job and fulfill job descriptions in order to receive equal pay, and this is regardless of gender. In a physical therapy clinic, it is important that when determining salaries for therapists and assistant aides, administration, staff, all types of employees, pay decisions must be based on job responsibilities, things like experience, qualifications, and not based on gender. To prevent these issues, clinics should implement transparent pay structures, conduct regular pay audits, and document all compensation decisions. These strategies help to ensure fairness and reduce legal risk overall. Our next example of employment laws, gender discrimination. And this case is an example of discrimination when it comes to gender specifically. Not specifically regarding pay, but gender specifically. A little bit different than the one we just mentioned, the one we just discussed. So in this case, Berkeley versus Marshall, or sorry, Marshall County Board of Education, it was a female coach that was denied the opportunity to coach a boys' team, and this was based on her gender. This relates to the equal pay, or I'm sorry, the equal employment opportunity laws, including Title IX, which prohibits discrimination in educational and athletic settings. In a physical therapy clinic, similar practices apply when hiring staff or therapists, or assigning roles in general. Decisions have to be based on qualifications and experience rather than gender, the same premise as the last example. To prevent these issues, it is important that clinics implement fair hiring practices and provide equal opportunities for advancement pretty much across the board for all employees, and maintain a clear anti-discrimination policy for all to follow. These strategies in total, all of them combined, will help to promote fairness in the workplace and reduce legal risk. And then application. So applying the information downloaded and received from this course to real life. So this course has helped me to understand the importance of legal awareness in a physical therapy clinic. Um, Personally speaking, I have kind of, like I mentioned a little bit ago, experienced some mishaps in the workplace, and some of these cases are very similar to what I have experienced firsthand regarding patient safety and things like that. So I do have a little bit of a heightened awareness of legal practices and the importance of legal parameters, and having like a structure to follow and things to make sure we stay away from. So one of the key takeaways is the role of risk management in preventing injury, which is one of the most important things, and protecting both the patient and the providers. And as a future clinician or a future health professional, I would focus on ensuring that the staff does follow proper protocols and maintain accurate documentation, maintain safety, uphold safety, and provide effective care at the same time. I would also prioritize fair hiring practices to ensure that all employment decisions are based on qualifications and not bias. Overall, understanding the legal practices and the legal standards allows healthcare professionals to create a safe environment in which they can do their duty and to be able to help others and do it safely and be protected at the same time. And so applying these practices to faith, because this is kind of why we're here, is to help people. We want to make sure that our heart posture is good, is in a good place, and it's important to make sure that not only are we operating from a place of like love and care, we are making sure that we're making smart and rational decisions and safe decisions. So um, this course has shown me that the legal knowledge and ethical responsibility, they do go hand in hand. My faith does provide me kind of like a blueprint to follow. And ultimately, it is a strong foundation for both. One of the scriptures I wanted to mention was Galatians 6:2, which emphasizes supporting others. And this aligns with caring for patients and coworkers in a clinical setting. As a future therapist, I would like to use these principles and guide how I treat others with compassion and with fairness and integrity with everything that I do. And it is important to recognize that applying personal beliefs in a workplace should not lead to discrimination or legal violations in any way. That isn't what Christ wants us to do on this earth. And so we do want to balance faith with professional and legal responsibilities just to make sure we are maximizing our efficacy as health professionals. Thank you.